Hello and welcome to the Extraordinary Health Podcast. I'm your host, Dr. Paul Beckham, and this podcast is sponsored by All Seasons Integrative Health in Fargo, North Dakota. In today's episode, we're going to be covering Enhanced Care, Full Body Chiropractic Care 2.0, a deeper dive into some of our advanced therapies and techniques. So, welcome to our podcast. This is episode 3 of our series on full body chiropractic care, where we're going to be exploring just the transformative world of enhanced care under our full body chiropractic 2.0 program. Hopefully and if you're already familiar with essential care, you're going to be in for an insightful journey as we're going to kind of more closely examine what differentiates enhanced care from our essential care. We'll cover advanced therapies and techniques used, how they support overall health and wellness, share patient success stories, and provide kind of a behind-the-scenes look at what you can expect in an enhanced care clinical treatment plan. What differentiates enhanced care from essential care? Enhanced care builds upon the foundation of essential care. Essential care mainly being pain relief care, and starting to build on getting that correct alignment and movement of, all the bones and joints, getting those muscles to function better, making sure you have the proper, stability as well, so you can start to build the proper function back with the muscles. Whereas enhanced care here, now we're going to have a little bit more comprehensive approach to pain relief, rehabilitation, and just overall, wellness. Here are some key differentiators. It's a more comprehensive approach. Enhanced care offers a more holistic approach by integrating advanced therapies and techniques beyond the basic chiropractic adjustments. Now we're going to focus on not only pain relief, but also some rehabilitation. And this is going to include even some specialized modalities that are effective for pain management as well as functional improvement. Some of those will consist of things like soft tissue therapies. We have different techniques like myofascial release and trigger point therapy that can target deeper muscle tissues and enhance recovery. We have other therapies that, not only from the manual standpoint, that can get down to some of the deeper tissues, even, as far as 5 inches. So even getting into, the hip joint itself in a lot of people. We also have personalized exercise programs. These are going to be tailored exercise programs based off of our testing that we perform in the office, which I'll cover shortly here. And these exercises are going to be, completely individualized for what you have going on. So not only going to help to improve strength, but also improve your mobility and overall function. Other things that we're going to start to look at are just some nutritional guidance here, getting you some basic nutritional counseling here, depending on what you have going on. Could be natural pain relievers, natural muscle relaxers, could be some supplements to help with healing up some of the soft tissues, including like your discs and your ligaments and other soft tissues. We're going to get into some of the advanced therapies and techniques that are used in enhanced care here under our full body chiropractic 2.0. We're going to start to utilize a variety of different therapies here, and they're all going to be dependent on what you as a patient are going to want to receive from care. Most of these are covered by insurance. Some are not. One of them right offhand is our class 4 laser therapy. We utilize K-laser in our office. It's a 100-watt laser. It can get the treatment done rather quickly. A lot of times it could be anywhere from a minute to 6 to 8 minutes, depending on the area that we have to treat. But this penetrates up to 9 inches. So with the K laser. We're getting through all the tissues there. It helps with tissue healing and pain reduction. It's an excellent choice. Dentists have used, lasers in their office for years, and it's helped kind of keep the pain levels down for people, but also help with tissue healing. We can be doing what's called instrument-assisted soft tissue mobilization, or IASTM, which basically is going to help break down any of the scar tissues, any myofascial restrictions, and also just help improve mobility, because we're going to be breaking down any of the tissues that are restricting you. And that could be from an injury, that could be from a surgery. It doesn't really matter. And, typically with just the ASTM itself, we can usually, I would say, get 80 to 90% of that scar tissue broken up. If we go back to some of the other tissue, or some of the other therapies, like a shockwave therapy, we have two different forms of that. We have more a mechanical one. That one can penetrate up to 2 inches deep into the tissues there. I would say now we're going to get up to 90-95% of that scar tissue broken up. And if we get into our more focused shockwave, which is an electrohydraulic form of shockwave, that can penetrate up to 5 inches deep. And we can really pinpoint some tissues with that. And there we can get up to, I would say, 95 to 99% of that tissue healed back up to a more normal status by using those therapies. Something else we use in the office is kinesiology taping. This can be used to help support the joints and muscles while also promoting proper lymphatic drainage, especially if somebody has an acute injury or something like that going on. It also can be used with just chronic injuries, also to just give some support to the tissues. Most people, when they have it on, if they've had something that has been painful, they're going to notice almost immediately after we apply the tape that they have, just better range of motion and decreased pain from it. Other therapies we use in the office are therapeutic ultrasound. This is not a diagnostic, it's a therapeutic ultrasound. It can help aid in reducing inflammation and also promote tissue healing. Typically in our office, we're going to use this in combination with an electric stim therapy. So we can even find things like myofascial trigger points and get those, completely out of there, taking them from, an active or inactive status all the way down to just a tender point. So we get them resolved for you and you don't have them coming back. We also have various different forms of electric muscle stim to enhance muscle strength, reduce pain, and accelerate recovery. One of those would be what's called Russian stim. That's used to help aid in rehabilitation of the muscles to help strengthen them back up. Whereas we have more interferential current therapy, which is really good at decreasing pain and inflammation and helping, just accelerate that recovery, especially when people come in with more acute conditions going on. So, how enhanced care supports overall health and wellness. Well, enhanced care, it's designed to go beyond just the symptomatic relief that, most places are going to get you there. We're also going to be aiming to support the overall health and wellness by addressing the root cause of the health issues. And those could be, just focusing on, identifying and treating, the problem areas and not focusing on the symptoms, because a lot of times when we're looking at neuromusculoskeletal conditions, it's not that if we chase the pain, we're really not going to find the problem. Because a lot of times the pain is being generated from other tissues away from, where the pain and inflammation is at. Acute injuries, more than likely, it's probably right in that area. But once we start to get into chronic injuries, now we're really looking at, hey, do you have myofascial trigger points, which could be causing referred pain to other areas of the body. And we need to find out exactly where that trigger point is at so that we can get that resolved for you. Whereas if we were to just treat the pain area, that's where people get frustrated over time, because they'll end up having to come back in over and over and over again to just get the pain dealt with there. And frankly, that's probably where we make the most money, is because people are just coming in to see get pain relief, more of that essential care. And they have to keep coming back in because we never get the problems resolved for them, because all they are coming in for is just that pain relief type care. So, if you're interested in getting your problems resolved, a lot of times it does not take that much longer here to get to the point where we get that proper range of motion, that proper muscle strength. We have all the diagnostic tools to even measure all this stuff. So you can even see it for yourself as you go through care. And, just take that little bit extra time to actually get things fully resolved for yourself. Also, enhanced care just improves just overall body mechanics, enhances just the overall movement patterns, your posture, which then helps to reduce, strain and prevent future injuries, because now we've gotten that proper alignment back to those joints, whether that be in your spine or your extremities. We're getting all your, the weight bearing tissues, should be your muscles and your muscles and your ligaments and your discs and all that in your body. And, your muscles and your tendons are meant for moving it here. So if we get closer to that proper alignment, the less stress and strain we put on the muscles and tendons, and we put it into the tissues that are meant to help hold you up against gravity here. Also, just by, reducing the stress on your nervous system, it helps to boost your immune system function, because proper spinal alignment supports an optimal nervous system function, which is just crucial in immunity. Your body's got to be able to recognize just when something's invaded it. And if your body isn't just geared towards, okay, I have this ache or pain going on over here, and it's focusing a lot of its attention on that, it's missing other things. Just think of, it's just busy trying to find things or calm things down that are causing problems, that if we were to get them taken care of, now your body can focus on, bad things that are coming into your body here, or your body's exposed to, so that your immune system can be boosted. The other thing is, it helps with stress reduction, combining just the physical treatments, even with some relaxation techniques, and even just promoting mental well-being. I would say even use some breathing techniques. It is super helpful in just reducing stress in a person's body. A lot of people get anxious just because they already have areas in their body that are just stressed physically. And when you have a physical stress, it comes out, and it's just easier to get mentally stressed. So if we can improve your body's physical endurance and just capacity there to handle stress, then physically it's going to be better. And then mentally you'll be even more resilient as well, because your body you don't have to focus on the physical aspect of your body, you can focus on the mental aspect. I think one of the big things with a lot of the patients that come in our office, they're looking for an enhanced athletic performance. Enhanced care is going to help provide that tailored treatment, because we're going to look at the physical exam, the 3D movement assessment that we do of people we're looking at balance, posture, gait, and functional movements, and creating a treatment plan as far as how to physically get you treated, as far as what we can do in the office, but also through rehabilitative exercise that you can be doing at home, and hopefully even to be a little bit more of a prehab situation, so that you're strengthening your body up before you get injured. So that way, even if you do sustain an injury, you can get back, into your sport as quickly as possible. So case studies and results from, patients with enhanced care have demonstrated, just significant success, just in helping these patients achieve their health goals. And especially the athletes can see just marked improvement, even to the point where they can come get treated. I've worked with pro rodeos. I've worked with college athletes. It's just amazing just how fast, like boom, right after they get treated. Worked with the NDSU marksmanship team. They notice even it's just easier to focus with their eyes in shooting, and they've shot better. I've watched it myself after they've gotten treated. And I know their coaches notice it as well. So it's getting you that clarity, because now we've removed some stress from your body and you're able to focus more on the task at hand. Here are some other case studies here. Patient with chronic back pain. This patient had achieved, a 70% pain reduction after 8 weeks of enhanced care. I mean, who wouldn't want to get 70% pain reduction? I mean, obviously, probably like to get it to go completely away, but when you have somebody who's got chronic back pain, it's just that chronic daily back pain, that chronic headache. There's no such thing as a chronic daily headache. There's something going on. You can't just cover these things up with medications or just going in to get treated for just the pain relief aspect of things. We got to dig a little bit deeper and get into the structure of what's going on and the function of everything here, so that we can get the condition resolved for you. Or otherwise, yes, you're going to end up having the same thing happen over and over and over again. Sports injury recovery. A college athlete, returned to play 4 weeks earlier than expected, thanks to just a customized rehabilitation program. And I've even seen it with my own son, who actually he broke his hand, and we were able to utilize all the things we've just kind of mentioned here. And instead of having to be out for 6 to 12 weeks, he was back to playing baseball in 4 weeks. Took him about 2 weeks to get back up to speed again with, throwing and all that again and batting, but had no issues with that. Or a migraine sufferer who reported a 50% decrease in the frequency and intensity of their headaches after receiving enhanced care treatments. Postural correction. An office worker was experiencing significant neck and shoulder pain. Improvement through, just the advanced therapies and posture correction strategies here, and just changes with ergonomics. So literally getting things strengthened up, in this person, their shoulder actually had certain weaknesses, was causing some misalignments, which was even causing pain into the neck. And yes, we got the neck treated because that was part of the whole problem here. But the thing that was causing the problem with her neck to go out all the time was her shoulder blade and the muscles around it there. So we had to get that shoulder blade adjusted, get that humerus adjusted, and just get the muscles balanced back out again here so that the problem didn't come back. So, if you were to come in the office, and see a behind the scenes tour here of some of the advanced therapies in the clinic, the advanced care that we do have, it really just starts off, with a lot of the state-of-the-art equipment. We utilize some advanced, not only therapeutic, but also diagnostic devices in the office, so we can get optimal results for patients. Each of our treatment rooms, are set up and designed so that we can have all the therapies that are needed that can be used by the doctors, especially with the chiropractic adjustments, as well as soft tissue therapies right in the treatment room. We also do have a rehab exercise area that's dedicated to, structural rehabilitation as well as functional rehabilitation of patients. And we also utilize it to just get people their strength back and get the proper mobility that they should have, whether that be in their neck or lower back, shoulders, hips, knees, ankles, feet, wrists. We have low-tech rehab, but I would call it functional rehab because you don't need fancy equipment here to actually get the proper structural alignment back, the proper function back for people. And once we do, the problem is not going to come back, and especially with some of the advanced therapies that we do use in the office. We have our diagnostic center here where it's just equipped with advanced imaging. We have some digital x-rays. We have some neurologic testing here. One of the tests is a pseudomotor test that we use with patients that have neuropathy, so that we can see just how much their autonomic nervous system is affected. Our physical exam helps look at the sensory and motor aspect of that. We also have just a patient education center. There's also patient education that is given to most, if not all, of the new patients that come in the office, so they can understand, what they're going through and things that they can be doing, not only in the office but at home to help speed their recovery. Hey, the patient, if you're taking that journey from essential care to enhanced care, there's just a tiny bit of a transition here, and we're going to be looking at things a little bit deeper. We're going to get into that initial assessment here, where we're going to have, just a comprehensive evaluation to determine, what really is needed for that enhanced care and advanced therapies here. You're going to get a customized treatment plan, that is going to be custom tailored to you based off of the testing that we've done. So that way, what you're getting is what you specifically need. It's progressive care. We're going to use some advanced modalities, if needed, and just gradually introduce them. If you don't want to use them, that's completely up to you. But if you want to get that speedy recovery, we're going to let you know what's going to work out best for you. We also do just ongoing assessments. Our patients are evaluated, especially if they're going underneath an active care plan, typically, on a monthly basis. And we're utilizing all those tests again so that we can see, just how you're improving here. And to make sure that if you aren't improving, that we get your treatment plans adjusted accordingly here. So all that will be gone over as you go through treatment as well. As I stated before, there's also some online education, just an empowerment, so that, when you are going through care, you're going to know what you can be doing yourself, at home, self-care techniques, different dietary changes you might want to be considering here, whether it be an anti-inflammatory diet or a keto diet or something like that. We'll make sure we give you recommendations for what would be, best fitting for your scenario. I guess things now, I just want to kind of get into some of the myth busting aspects about just advanced, chiropractic therapies. There's just several misconceptions about advanced chiropractic therapies, and, kind of here's the truth. Most people think that chiropractic care is only for back pain, maybe for neck pain, maybe for headaches. But the truth is that it addresses the whole body. It's going to include your whole health, including your joints, your muscles, and your nerve tissues here. We're also going to look at metabolic things in our office, because we're going to use some functional medicine evaluations to determine if you need anything as far as changes in your diet or your nutrition or phytonutrients that you might need here. We're going to look at lifestyle changes that you might need to be considering, whether it's just sleep habits, exercise habits, even if there's even just mental health issues that need to be addressed, and that might be something we need to, even refer you out for. But, one of the next myths is that adjustments are painful. Well, most patients find, they experience basically relieving and relaxing. I mean, the adjustment, the process of going through it. I mean, we might be working on tissues that are already painful or swollen. And, typically we're going to work around them until we get that out of there. But yes, we're going to be working on, just like going to the dentist. You think everything's fine, and they get in there and they start working on something, and also you realize, that hurts. We're going to work up to that point because we want to get this issue resolved for you here. Another myth is that just the results are temporary. Well, with our enhanced care, the focus is on long-term improvements and sustainable health. We're focusing on getting this condition resolved for you here and giving you things that you can be doing even after you're done with care to help maintain that. Some of our patients will follow through with wellness type care, but that's, again, a choice that you need to make yourself. We're not going to force you into it, but if it's something that could be beneficial to you, we're going to let you know. Another myth is that this chiropractic care is just not scientific. And I graduated a long time ago. I started using everything I possibly could to measure things with patients. I started off with an exam called a QFCE, or a quantitative functional capacity evaluation, to evaluate my patients and make sure that they had the proper range of motion, the proper strength, the proper alignment of things. Different techniques like CBP, where there's even x-ray measurements to make sure that we're getting the proper structural alignment back for people, especially in their spine. Because if we don't get that back, then, hey, you're going to have some structurally weak areas here that will not improve. They're not going to get to a point where it's going to be stable, where you're going to have the best health, because you're always going to have that area be stressed because it doesn't have that proper alignment. You're not going to have the proper range of motion or, stability to that area. So, what are the criteria for transitioning from essential care to enhanced care? Well, if you're having persistent symptoms, like I kind of mentioned before, you maybe you've had just that essential care. That's all you've really wanted. Maybe you've just been to your primary care doctor and, the medications they're giving you, hopefully you choose to come in and get something done more naturally beforehand. But a lot of people are going to be taking different kinds of medications, and, it's hard to fix. It's almost impossible to fix a physical problem with a chemical solution. It's not going to work. And that's the problem with most people. They do have a physical, biomechanical joint problem, and you're just going to cover up the symptoms with the medication. That's going to numb things down. It's going to maybe temporarily get rid of some inflammation, but then that's where we get into some of the functional medicine stuff, and people are having more systemic inflammation going on. That's causing even more problems now because they've been using vitamin I or ibuprofen on a daily basis just because they have something that's painful or inflamed or swollen. It's just, those are some red flags that you should be paying attention to here, so you can come in, get evaluated, and hopefully get your problem resolved for you. You might have a complex condition. If you have multiple or interrelated health conditions, that's going to require, a little more intensive treatment. Or you've had chronic things going on, you just didn't even realize from all the years of you riding in a tractor, bouncing up and down, driving a vehicle, you're climbing up and down ladders, construction-wise, you're sitting at a desk for a long period of time and not getting up. Those can end up causing chronic issues, and we need to get them resolved so that long-term you can have hopefully a pain-free life and better quality of living, so that you can do all the things you want to be able to do. There could be performance goals like athletes. Athletes or individuals, say they're looking to optimize their physical function and performance, and by coming in and, yes, getting all those bones and joints aligned in their body, getting, that proper functional back to the muscles which maybe aren't functioning quite the way they should, they can now function more optimally in their sport or activity. Sometimes, it's just patient preference. Some patients do prefer to come in and get that more in-depth and more personalized approach to their care, rather than just coming in and treating it more like Dr. Aspirin to get the pain to go away and inflammation to go away. And as soon as it does, then you leave, but you've never really gotten the problem resolved. I can think of patients that do that all the time. They self-discharge themselves because, hey, it feels better. Yeah, feeling better is one thing, because pain is usually just the tip of the iceberg of problems here. It's not going to fully go away until we've dealt with everything that's underlying all that. There's, we have specific advanced technologies that we use in our enhanced care that leverage, these advanced technologies to provide more precise and effective treatment. Like our 3D motion capture system, we have it on a few different things now. This is going to allow for, a detailed movement analysis, or they call it a functional movement screen. This functional movement screen is used by all the professional sports teams anymore to assess their athletes before they even get on the field, so they can do some prehab, as I kind of talked about before. And you can also personalize people's treatment plans based off of this. So this 3D motion capture system is now even utilized with, our foot scanning device. You can even, measure different posture with it and all that. And even digital posture from the 3D system. By taking a look at your posture, I mean, a lot of it is, I see it myself, but by having something else that's computerized actually showing exactly kind of what I'm seeing anyway, it's nice to have something that we can use, like I mentioned before, typically on a monthly basis when a patient's going through care, so we can make sure that we are getting these postural imbalances corrected there. And if we're not, then we need to look at, obviously changing your treatment plan so we can get that done for you. Other things that we use are like our therapeutic laser system. Like I say, the one that we have is, as far as what I've seen, it's the most powerful laser. We've had it now for a couple of years. It speeds treatment up for patients so that you can come in, get it treated. You're going to get that pain relief. You're going to get that inflammation reduction. With our neuropathy patients with the laser, it's really even helping heal those nerves back up so that long term, you're not having that neuropathy come back here. Our shockwave therapy device. Again, I kind of mentioned we have two different ones in the office. One is a more mechanical device that helps to kind of break up scar tissue in the body there and helps treat a lot of different musculoskeletal conditions. And another one's electrohydraulic and penetrates, much deeper, up to 5 inches there. And what I see with these shockwave therapy devices, especially the electrohydraulic or focus shockwave we have, patients are getting better probably at 3 to 5 times faster than previous therapies we've had in the office. And again, we've had, the focus shockwave now for a little over 2 years. And it's just crazy to see the results that we get from that. Our diagnostic imaging, it's a digital x-ray system that I have in the office. Just helps out by being able to get nice, clear images of the bones and joints that we need to work on to make sure that we can see if there's anything odd going on there when it gets to the spine, even being able to measure some of the alignment and all that going on to make sure that we have the proper curves in the spine, the proper angles and all that. We can get patients home exercises that will help with structurally correcting what's going on as well. So in conclusion, we'll try and wrap this up here. Enhanced care, under our full body chiropractic 2.0 provides a holistic and advanced approach to chiropractic care. It's combining cutting edge therapies with just personalized treatment plans to get the best results for you. So whether you're dealing with chronic pain, recovering from an injury, or looking to optimize your overall health and performance, Enhanced Care offers a pathway to better health and wellness. Consider taking the step from essential care to enhanced care for a more comprehensive approach to your health journey. Well, I hope that information helps here today. And hey, we look forward to you, just following us, like us, go out and seek us out, look for our website, follow us on our social media accounts to get the latest updates here on what's going on in the office and just all the new latest cutting edge therapies and technologies that can be used to help benefit you as a patient to get better results and get that better performance. So thank you for listening, and we're always here to help you finally feel good and live your full potential.